Hi, I'm Jamie Marbo with Inspired Hygiene. I'm sure many of you, like myself, have been to a few college and high school graduations and ceremonies. In fact, both my daughters graduated, my oldest from college and my youngest from high school. And I couldn't help but reflect back to my own college graduation from dental hygiene school. I was thinking about how even though I was given a lot of great tools and information so that I could pass my boards, I'm not practicing hygiene the same as what I was taught. One of those is that I'm not doing is I am using my ultrasonics and my piezo a lot more than my hand instruments. When I was in hygiene school, I was taught that the use of our ultrasonics was primarily for calculus removal. Well, that's just not true. Our ultrasonics and our piezos are used for biofilm removal. In fact, it's very effective that way. And so I want to challenge you all, if you're stuck in the mindset that your go-to instruments are your hand instruments, I want you to think about a few things. First of all, we can't get our hand instruments to move 30,000 times a second, no matter how hard we try, right? So from a time perspective, it's a lot more efficient just from that perspective. It's also use of ultrasonics are a lot better and easier on our body. We're using a lighter touch, a lighter grasp, and we're able to disrupt the biofilm with not as much strain on our body. The other thing is that makes it so effective is that there is an acoustic turbulence and microstreaming that is creating more biofilm disruption in the base of those pockets than what we can ever do with our hand instruments. Let's face it, our hand instruments only remove what we touch. So that would be in comparison to like a manual toothbrush and floss. There's still a good need, there's a need for it, but when it comes to effective biofilm disruption, we lots of times are recommending water picks and ultrasonic toothbrushes, right? And there's a good reason for that because they're doing something beyond what they are touching, like our string floss and our manual toothbrush. So that micro streaming, the air bubbles and the water and the air bubbles, and then the movement, the acoustic turbulence is breaking up our biofilm very effectively, okay? The other thing, the biggest pushback we get from our clients as to why they go to hand instruments versus ultrasonics is typically the comfort level of the patient and or the mess. So I want you to think about a couple of things. When we are using our tips and our inserts, we need to make sure that they're in good working order. So that is the stacks aren't bent, they're not separated. That's going to be important for the effectiveness. And also, if the tips are not worn, the only working end is 2 to 2.5 millimeters. So get out your wear guides and make sure that they're not worn. If they're past the wearing that 2 to 2.5 millimeters, the working end is not doing its job anymore. And probably you're just creating some chattering and some banging against the tooth. That's going to cause sensitivity to the patient. And also it's going to cause burnished calculus. So make sure that you're checking those, okay? The other thing I want you to think about is your adaptation. So the adaptation of your magnetos is that you can use the backs and the sides and the face. The only part that you can't ever have touch the tooth is the actual point. So if we can never have the point touch the tooth, then you didn't make sure that you are using the right equipment. You would never use an anterior sickle back in your posterior multi-rooted teeth to clean out a furcation or to get around your roots, right? So why would you use a straight slim light earth insert back there? You need to have your left and your rights. If you do not have your left and your rights, you're probably causing some damage and pain in those posterior teeth. So a couple of things for you to think about. And if you or your team members need help and you haven't been taught or had any hands-on training with your ultrasonics, give us a call. We do a lot of private training, full-day trainings, hands-on with live patients to our private coaching clients. So you don't have to be a private coaching client. Give us a call. We could do a rock star event with live patients and come to your town and put this on. But so if you need some help with this, give us a call, but also get out your inserts. I use mine 90% of the time now and my hand instruments 10% of the time. And it is saving me a lot of time, wear and tear, and I'm disrupting that biofilm a lot more effectively than if I was just using hand instruments. So think outside the box. Thank you, and make it a great day.